The much-anticipated posting of the Cuban doctors to the county referral and level 5 hospitals came to pass Wednesday, with the doctors enthusiastic about the deployment to the new workstations.
We are here to work together with our colleagues, Kenyan doctors, and learn to the experiences of them, the nurses in the counties. Today, in this day, go to the county to work hard with you, with the doctor here and in the hospital, in the different facilities that we will go to work.
I'm going to work in Bomet County as an endocrinologist specialist. An endocrinologist deals with the growth disorders, hormonal disorders, the diabetes patients, provides overall comprehensive care for diabetic patients, and it is an important specialty for all the ill patients.
Doctors in a colorful ceremony presided over by President Uhuru Kenyatta at the launch of specialized maternal child health and immunization equipment at the Kenya Medical Supplies Agency warehouse in industrial area, Nairobi. The doctors are expected to report to their new workstations in the 47 counties this week. The head of state rallied healthcare providers and other stakeholders to offer support to the Cuban specialized doctors as the government strives to achieve universal healthcare for all.
The 100 Cuban doctors here, specializing in fields ranging from cardiology, neurosurgery, amongst other specialists, are now ready to move to the counties, and I'm delighted today to formally send you off to deliver the much-needed services that our people require. And I call upon all Kenyans to embrace and support them as they would their brothers and sisters.
We and the health teams in the counties represented here by the CECs and their governors are delighted about the Kenya-Cuba cooperation. We look forward to learning from you, our colleagues from Cuba. We look forward to you mentoring our colleagues in the counties. We especially look forward to learning from you on the provision of primary health care, which is going to be a major driver of universal health coverage.
He pointed out that the Cuban doctors will help build the capacity of local doctors as well as boost the doctor-to-patient ratio that stands to 1 to 16,000.
Local specialists are few and far between, yet their services are in high demand across the country. The bilateral agreement reached between Kenya and Cuba will therefore enhance health collaboration in specialized service provision and also help build up our local capacity, as was mentioned by Governor Kuti.
Doctors who will be leaving for the counties will not only participate in the management of patients, but they will also impart skills to our own doctors so that by the time they are going back, we will also have skilled doctors that will work and continue with what you are doing.
The doctors who have been in the country for the last 2 weeks underwent an induction program. Each county will receive at least 2 specialized doctors.
In this relationship, Your Excellency, we will have these doctors stationed in the counties for 2 years, and then we are also sending in September 50 of our own doctors to Cuba so that they are able to learn and get skills to come back and work. I am just begging that this relationship between Cuba and ourselves be strengthened, Your Excellency, so that even after 2 years, we have more doctors coming and more of our own doctors going to Cuba to gain those skills so that we build on our own skills.
The national and county government signed a deal that will see the national government pay their salaries while the county government foot their bill for accommodation and transport. Linus Moshigadi for Channel 1 News.